Depression of right rib, seated and prone.
And once again, for your test, typical test question would be, we want you to assess depression of the first costal or the first rib on the patient's right side seated. We made our introduction. I'm next going to go through my system over here. If I check the equipment comes next, I want to set it up for both the patient's height and check it for security. Do me a favor, sir. Can I have you sit facing the camera if I could? Patient's position, we want them to sit in a nice neutral posture. Basically the legs in front of them, knees about 90 degrees. To palpate, your segmental contact point is going to be the superior margin, technically of the proximal first rib. How do you locate that? It's Dr. Browning, we do what's called wrap the trap. Now coming with the camera over here, what you want to do is right at the base of the neck is where the trapezius fibers, the upper trapezius, comes in behind the SCM muscles. There's a little valley in there, and that's really where you want to kind of be. So I'm going to reflect the trap back a little bit, sneak into the valley and push straight down using my finger pads. And that's going to be the superior aspect of that first rib. We have three methods that we showed you in class. One, I can just check the end play by pushing, in this case, S to I, from lateral to medial, in this case from right to left, and feel the resiliency or lack of resiliency of that joint. Two, we have the teeter-totter method. This hand remains the same, superior margin of the first rib. I'm going to contact the superior margin of the contralateral side as well. And this time, since I'm assessing the right, I'm going to press down on the right. So once again, I press S to I, from lateral to medial, in this case from right to left. Not only can I feel the resiliency in the joint here, but in a normal moving joint, I should feel the contralateral side elevate. If I don't feel that, and I feel the firmer lack of resiliency, I would suggest that saying that this is a rib that has dysfunction. Last but not least, I can passively laterally bend and extend while palpating the first rib on the right. So while palpating the first rib, I can take the head now and passively laterally bend and extend the head to that side. You're not going to jack the head, you're just going to basically take it to where it wants to go. In a normal moving rib, what I should feel is that as I laterally bend and extend, the rib should depress on that side. That would suggest a normal rib. If on the other hand, the rib stands at its ground, it implies that there's dysfunction in this first rib, being more so the costotransverse and costovertebral joint.